This is my audience. Why do we breathe? Well, we breathe to maintain life and to get oxygen into our bodies to get the blood from one point to the next. And the normal adult takes 12 to 20 breaths per minute. And when something compromises that to where they're not getting the right amount of oxygen in their blood, something can go wrong. Something normally does go wrong. So for emergency medical responder, it's our first priority to make sure that their airways are clear and that they're breathing. They go together. And so when our patient is having trouble, we need to figure out how we can help him. And there's 3 devices that we use to help them maintain that airway. We have the oral airway, the nasal airway, and then the king tube. And the oral and airways, to maintain it, while the king tube will let us help them breathe. And so to use those devices, they basically are unresponsive, they don't have a gag reflex. And so our first one is the oral airway. And the oral airway, there's different sizes for different patients. Since everyone's not the same size, same shape, you have to have different sizes. And so to measure it, to make sure that I'm putting the right size in my patient, I'm going to measure it from the corner of his mouth to the end of his ear here. And it's going to look like this when it's inserted into my patient's mouth. It's just holding down the tongue there. So when I insert it, I'm going to do the chin lift maneuver, and then I'm going to insert it sideways like this, in his mouth there, and then I'm going to rotate it 90 degrees. And so that's just holding down his tongue. There might be some cases where I can't use the oral airway, and I'm going to have to use the nasal. And some of those are if my patient had a seizure and could have swallowed their tongue, allergic reactions where their tongue's swollen to where it's already blocking the throat, or they had a trauma to the mouth or the throat. So I'm going to have to move on to the nose because their mouth has had damage to it. So this is my nasal airway, and I measure it just kind of like I did with the oral, except I go from his nose to the end of his ear. And this, I have to put a water-based lubricant on. And so I'm going to put that on now. So I'm just going to squirt it. And then I'm going to just insert it into my patient's nose. Just like so. And that helps get air in, just like my oral did. It just helped maintain that. So if my patient stopped breathing altogether, I'm going to have to help him breathe. So my next step is my king tube. And my king tube looks like this. And it has these 2 balloons that help hold it in place. And like I said earlier, he cannot have a gag reflex. And here he stopped breathing altogether. So this device, I'm going to help him breathe. I'm going to breathe for him. So I'm going to insert it in here like so. And there's 3 different sizes. There's a 4 to 5 foot, 5 to 6 foot, and a 6 foot plus. And so according to what height our patient is, depends on which one we use. And it has some measurements here on the side, which tells me how far I'm going to insert that. And so I'm going to take this, and I'm going to connect it, and then just blow up those balloons so that so my device is not moving around while I help him breathe. And the king tube by itself is not, you can't use it by itself, it's pointless. It just it's blocking our airway in a way. So its partner is the bag valve mask. And the bag valve mask is going to breathe for him. So I'm going to hook it up, and then I'm going to squeeze it once every 5 seconds to make sure the air is going in. And so his lungs move. And so I'll wait 5 seconds and do it again. And so I'm breathing for him. So as an emergency medical person, it is always important to maintain their air. make sure that they're breathing at all times. Whether we're assisting them, they're breathing by themselves, or we have some oxygen on them. And so, in the length of my speech, there could have been a patient that experienced some breathing troubles, breathing compromises, and they could have experienced a biological death, which is where they stop breathing and their heart stops and their brain cells stop altogether, and it's not reversible. So it's always important that emergency medical providers get there as quick as possible to help them maintain their airway.